Hi friends, welcome to classes by Lab Doctor. I'm Dr. Divya, and in today's class let us understand about the causes of oligospermia, the causes of azoospermia, and how can we prevent and treat these abnormalities. So semen analysis में एक important part है the counting of the sperms or the sperm concentration. So इसमें WHO ने दो terminologies use किए हैं, एक है sperm concentration और दूसरा है total sperm काउंट. तो आप जब एक सेमेन एनालिसिस रिपोर्ट भी देखोगे तो उसमें रहेगा स्पर्म काउंट और टोटल स्पर्म काउंट. तो ये स्पर्म काउंट और टोटल स्पर्म काउंट में क्या डिफरेंस है? स्पर्म काउंट इज द नंबर ऑफ स्पर्म्स विच आर प्रेजेंट पर ml ऑफ सेमेन. पर ml ऑफ सेमेन में कितना स्पर्म्स है, और WHO के हिसाब से इट शुड बी मिनिमम 15 मिलियन पर ml ऑफ सेमेन होना चाहिए. टोटल स्पर्म काउंट मतलब टोटल नंबर ऑफ स्पर्म्स इन द एंटायर इजैकुलेट. पूरा इजैकुलेट में कितना स्पर्म्स है वो उसको हम बोलते हैं टोटल स्पर्म काउंट. तो मतलब एंटायर इजैकुलेट में मिनिमम 39 मिलियन स्पर्म्स होने चाहिए. सो दैट इज द डिफरेंस. सो दैट इज व्हाट द WHO सेज, दैट आपके स्पर्म कॉन्सेंट्रेशन जो है पर ml में मिनिमम 15 मिलियन स्पर्म्स होने चाहिए पर ml में, एंड जो टोटल स्पर्म काउंट है जो पूरे इजैकुलेट में होना चाहिए वो मिनिमम 39 मिलियन होने चाहिए. So oligospermia is when the sperm concentration per ml is less than 15 million. Suppose the sperm concentration is more than 200 million per ml, that is called as polyzoospermia. And don't think that agar sperm concentration is more than 200 million per ml the patient will not have infertility क्योंकि उसके पास ज़्यादा sperms है. It doesn't happen like that, because lot of sperms will hinder the movement, the progressive movement of the spermatozoa, and that also can cause infertility. And the third category would be azoospermia, wherein there is no sperms in the ejaculate. So we all know that the common symptoms of this low sperm count would be, the most common thing would be the patient would have no symptoms at all. He might just come for the testing because they are unable to have a child. So when they come for a testing for infertility, that is when we identify majority of the patients having low sperm count. So they may not have any symptoms. But suppose if in case if the sperm count is less because of some hormonal issues like low testosterone etc., patient might come with low facial hair, low sexual desire, low libido, or he might have erectile dysfunction, sexual dysfunctions etc. So this could be few of the symptoms of low sperm count. So what are the causes of oligospermia or less of sperms in the semen? One is if there is a defect in the tubules that transport the sperm. Suppose if there is a defect in the vas, there could be injury to the vas, or there could be some surgery, there could be infection, there could be trauma, or the vas difference may not have developed properly, such like some genetic condition like cystic fibrosis etc., inherited conditions. Such conditions can also cause low sperm count. Suppose if there is any chromosomal defect, suppose if the patient is having Klinefelter syndrome, or if he is having Kalman syndrome etc., wherein there are certain genetic defects which will not allow the testis to produce the sperms, that time also the sperm count can be very less. Suppose if the person is having ejaculation problem, if there is a retrograde ejaculation, instead of passing from the vas deferens through the urethra, if it goes back into the urinary bladder causing retrograde ejaculation, then also the sperm count in the semen will be less. Certain kind of medicines, they can also cause low sperm count. Antibodies that can attack the sperms, they can destroy the sperms and lead to low sperm count. So there could be autoantibodies, anti-sperm antibodies, certain tumors of the testis, epididymis, etc., wherein they can destroy the testicular tissue and they can lead to low sperm count. Suppose if there was a surgery, if there was a radiation, if there was a chemotherapy which was given to the testis to treat the tumor, that can also affect the sperm count. Suppose if the testis was not developed properly, there was an undescended testis, then the sperm count could be less. Suppose if there are hormonal imbalance, like I've told you, LH and FSH are very important in development of the testis and formation of the sperms, etc. So if the pituitary hormones and the testicular hormones like testosterone, they have certain abnormalities, then also the sperms count will be less. Certain medications I've told you, like testosterone replacement therapy, certain anabolic steroids, certain cancer medications, chemotherapies, antibiotics, etc., they can also impair the sperm production. Suppose if there were prior surgeries which were done in the form of vasectomy, or it could be a repair of inguinal hernia, if there was a scrotal surgery, or if there was a epididymal surgery, prosthetic surgery, such surgeries can sometimes cause damage, and they also can cause low sperm count. So environmental causes in today's life, there are many of the lifestyle factors and environmental toxins like industrial chemicals like pesticides, herbicides, organic solvents, paint materials, etc. Heavy metal exposure like lead, exposure to radiation or x-ray, they can reduce the sperm count. If there is overheating of the testicles, like suppose sitting for a long period, sometimes wearing tight clothing or working on a laptop computer for a long stretches of time, they say that the temperature of the testis might be affected, and that can also affect the count of the sperms. So these are the causes for low sperm count. You can classify them as testicular, pre-testicular and post-testicular. Testicular, the ones which are related to the testis. The pre-testicular are the hormones, etc., which is required to produce the sperm, and the post-testicular, which is the blockage of the ducts. So how do we diagnose this oligospermia? By semen analysis, urine analysis to test for retrograde ejaculation, ultrasound, it could be transrectal and scrotal ultrasound. We test the endocrine system to measure the hormones, and certain genetic testing also could be needed to detect this oligospermia. And how do we treat oligospermia? It is treated depending upon the cause. Suppose if it is a varicocele or it is a blocked duct, then we will have to do a surgery for a varicocele or blocked duct to treat the oligospermia. Suppose if there is an hormonal imbalance causing a decreased sperm count, then we will have to act on the hormones. If there is a medication which is causing low sperm count, that medication had to be removed. Suppose if there is an infection causing a low sperm count, the infection has to be treated with an antibiotic, antifungal, etc. So these are a few of the cases wherein the cause can be treated and the oligospermia can be reversed. So azoospermia is when there is no sperm at all in the ejaculate. Oligo is less than 15 million per ml, and normally it should be more than 15 million per ml. So here also there are three types of azoospermia. One is the testicular azoospermia, wherein the cause is in the testis, like it could be testicular trauma, testicular surgery, testicular tumor, etc., which can affect the testis. It could be a pre-testicular azoospermia, that means because of certain hormonal abnormalities, hormones of the pituitary like LH, FSH, which are required for the production of the sperms, or the testosterone abnormality. So that could be the pre-testicular azoospermia. And the last would be the post-testicular azoospermia. The most common type of azoospermia is this post-testicular azoospermia. 40% of people who have no sperms in their ejaculate, they have some kind of an obstruction in any of the pathway of transport of the sperm. Like it could be in the vas deferens, etc. So there is a blockage or there is a obstruction to the flow of the sperm, which is causing no sperms in the ejaculate. So when we say azoospermia, remember at least two samples should be having no sperms, and these two samples must be analyzed on 2 different days. Then only we can tell that the patient is having azoospermia. And before we give a diagnosis of azoospermia, the semen sediment also, when we centrifuge the semen sample and examine the sediment also should not show any sperms. Then only we can label it as azoospermia. And the most common cause, as I've told you, is because of an obstruction to the semen flow. So how do we improve the sperm count? In the majority of the cases, we will have to treat the cause. Suppose if a cause is identified, we will have to treat it. That will definitely improve the sperm count. The rest of the things which can be done is you can have a proper balanced diet rich in fibers, antioxidants, etc., sufficient hydration, and regular workouts, exercise, maintain a healthy body mass index or a healthy weight. We might have to reduce the obesity by diet and exercise, get adequate sleep, reduce the stress, avoid exposure to environmental toxins. It could be avoid exposure to environmental toxins, reduce smoking, reduce alcohol, reduce the drug abuse, etc. So that a healthy lifestyle with a proper diet and exercise and certain supplements can help to improve the sperm count. These are the causes of oligospermia, azoospermia, and few things which can be done to improve the sperm count. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.